Welcome to Greenable Woodbridge. I'm your host, Carolyn Ehrlich. You know, we talk a lot about having clean air to breathe and clean water to drink, but the most important part about sustainability is probably the life we lead and making sure what we do is a healthy, sustainable lifestyle. And in Woodbridge, we have a whole department. All they do is work, their mission is to make sure we're healthy. And that is our Department of Health, led by Dennis Green, but the chief health official is with us today, Phil Bajowski.
Good to be here.
And with all of the things that you work on, and we could talk for 4 hours about all the things the department has, Phil wanted to share with us something that I know hardly anything about, so I assume the viewing audience has a lot to learn. And that is vape and e-cigarettes. And why is that important? Why is that something we should know about?
Well, it's particularly important because of the potential health concerns with it, and specifically the health department's concern, and what I'll share with you is our initiative with respect to protecting our young people of the town. So we all know what a cigarette is, which is basically tobacco in a rolled paper, you're igniting it. So a vape, you're igniting
I've never seen a vape. Yeah. This is interesting.
So what happens is one would charge this to their computer, charges a battery, and you would pour a fluid, an oil in here, different flavors, and we'll talk about that. And then you would press a button, and it heats that, and you would inhale it and get that flavor. So that is one version of it. And then the one that we're a little more concerned about because it's easily concealed and maybe more desirable by underage folks is something like this. Now this has a cartridge. So the fluid is in here. There's a battery in here, very similar to that device, and it gets ignited, and you just suck and get the vapor. So basically what's happening, you're heating a liquid, which creates an aerosol, a vapor, if you will, and you inhale that.
So how does it compare to inhaling smoke when you smoke a cigarette?
Well, the interesting thing is it is not risk-free. There is nicotine in vape, as well as other chemicals that can be harmful. And although it is not illegal, it is a concern, and it is very much like tobacco. There's an age limitation on it for people to purchase it. And you need to be over 21 or over to legally purchase it.
And I understand the health department is licensing the vape stores, and tell us a little bit about that.
Very good. So folks may have seen in the news recently that the FDA has publicized their concern for the flavors of this and targeting young people. So listen, adults can, for each country, you can choose to do this even if it's not good for you, but we're particularly concerned, as the FDA is, about young folks, because nicotine, studies have shown, impacts adversely the brain functioning and development of young people more than it does older people. As we know, nicotine is not good for you. But what's interesting, and this is what FDA expressed, the flavoring. Here's a couple of samples: cool berry melon, blueberry cream.
Sounds like candy.
Thank you. We're like an ice cream store with 31 flavors, fruit smash, and so on and so forth. So what occurred was at the end of 2017, a cooperative effort in recognizing the concern for underage between Mayor McCormick, Health Director Dennis Green, our governing body, and myself. We wanted to do something proactive to control this with respect to underage. So what we did was we produced and put into effect an ordinance that requires any retailers of any of the components of electronic cigarettes, you must get a health license with the health department. It is a $900 annual license, so it's pretty, it's steep, and it's renewable each year. Now, the purpose of that is so that we could monitor, I first identify who's selling these things, so that we can go out and conduct integrity tests, age of sale enforcement, to protect our young folks.
So I remember at the very beginning of this program, you had a hard time getting the businesses to get the licenses.
Starting any new license, because it's not something that everyone's going to know about. We literally had to go out and canvass all the usual suspects of who might, a lot of legwork, visiting all kinds of convenience stores, liquor stores, and any number of potential. And it was a little surprising as to the variety and diversity of establishments that do sell this product. So at the end of 2018, we identified and got licensed 55 such establishments. And what's more interesting is the renewals for these folks. Virtually all of them are renewing for 2019, and we have a licensing revenue total of over $100,000.
Whoa.
The beauty of that, when we wrote the ordinance, that the revenue is dedicated to be used for the education and enforcement of underage sales. So we can use that for that purpose.
So do you ever have somebody go kind of undercover?
Well, that's very good. Some years ago, through a grant from the state of New Jersey, we had conducted tobacco age of sale enforcement, and so we had a great experience with that. We got a lot of people in compliance with Woodbridge Township. We were recognized by the state health department as one of the top municipalities in the state for our work and activity in this program. So now, with the advent of this new product, what we're going to do now is we're going to go out, and it will involve us under the guidance of a licensed inspector like myself, or Mr. Ravino, who's going to be coming on the program shortly to talk again about protecting our youth in a different format. Under our guidance, we will have someone between the ages of, say, 16 and 19, an underage person. We will bring them to, and this is why it's important that we identify all the stores that sell this. We will have them go into the store and attempt a purchase of not only e-cigarette components, but tobacco as well. And we will see what the results are, and to make sure that folks are abiding by the law and not selling to underage persons.
What's the penalty for selling to children?
A minimum of $1,000 fine on the first offense.
It's a lot.
Yep. So
if it were up to me, I'd take away their license if they close the door.
So we're very serious about it. It's something we're very proud of, because we were just talking about the FDA. So we put this together at the end of 2017. The FDA is just starting to talk about it now. So in Woodbridge, through the guidance of our mayor and our governing body and all the people in the health department, we're ahead of them. So with our concern specifically, most importantly, to the potential for the underage targeting, use, and sale of this product.
Wow. Now, do you find, because of this, or maybe not at all, any correlation at all, do you find the tobacco use is going down, or are young people using less tobacco, or it's still what it's always been?
We don't know what the statistics are on this. What is interesting is it was thought of originally by probably the manufacturers that it's going to reduce tobacco smoking. It's going to be a means of getting off of tobacco. Studies have shown at this point there is no evidence to suggest or to confirm that vaping is an effective means to wean you off of tobacco.
Very interesting. So in a sense, if people try that to get off of tobacco, they might just be adding another addiction into their life.
Thank you. And that is the concern. And moreover, our concern with the health department is that we're going to attract with these flavors underage people who would never have smoked tobacco, a cigarette or a cigar or chewing tobacco, right, which are all bad enough. But they may be enticed by, oh, geez, let me try this coconut cream.
Right.
And so here we are with all this good work and all the advertisements on what the harms of tobacco are. Now that gets erased by introducing a new product.
Very interesting. So we got a few more minutes. How would you like to sum this up?
Well, I think we described everything, what our mission is, and we're, like I said, we're very proud of the initiative. I'd say as far as the sustainability portion, one thing is the way we wrote the ordinance. Every activity that we conduct with respect to the enforcement, the canvassing, going to court, is all covered by the cost and the revenue of the license. It's all done after hours, and we could, so we're very proud of that. It doesn't compromise any of the other great things that we do. And this might be a little bit humorous, but if we can stop young people from using this, it'll minimize the amount of toxins that are exhaled into the air.
I was just going to ask you, I forgot to ask you about what impact this has on our air quality. Obviously, it's not good.
Hey, at the end of the day, if you're blessed enough with good health, right? Not everybody is. Why do you want to compromise your lungs? You kind of need your lungs to live.
Right, exactly. A little bit. Well, I really appreciate you taking a little time out of your very busy day. You do all kinds of other things in the health department other than just the vapes. I know you inspect all the restaurants, which we're going to have a special show just for that.
Yep.
The child care centers, you're all over the place.
Our residents and youth safe as best we can.
So thank you for coming on.
It was a pleasure. Thank you.
And we're just going to take a little break, and we will be back in a few minutes. Thank you.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Welcome back to Greenable Woodbridge. Our guest now is Anthony Ravino, the newest member of the health department, and welcome on board.
Thank you so much.
You're very brave to come on TV.
First time on TV.
Yep. But you have a great topic to talk about.
Yes, sure do.
Because this is so important. And the topic is lead. And
lead poisoning in children.
Lead poisoning in children, and people are talking about that more and more. It's all in the newspapers. Tell us a little bit about the issue.
Well, you know what? Lead poisoning is not necessarily a new thing. It's not like this just overnight they did studies and said, oh yeah, lead poisoning is a problem now. That's old news. And actually there's data showing back from even as far as the Roman Empire that people were lead poisoned. So it's there and we know the effects. Lead is actually an element on the periodic table, and it's a bluish metal. It's very heavy. You know how when you go to the dentist office, they put that jacket over you? That's actually made of lead because it's protecting your body from x-rays. So it's one of the few metals that can actually do that. So anyway, though, it's good at being a binding agent. It's malleable, and it actually melts down very easily. So the reason why I'm saying this is it's meant for industry purposes. They still use it in cars, batteries, bridges, all that kind of stuff. Anyway, why do I bring that up? It was actually brought to the attention back in the 1970s that it's been in consumer goods, such as paint. Paint's the biggest one that we know of. Gasoline. It was in leaded. Gasoline that was leaded was better at burning. It was more fuel efficient. It was just good for the car, but it wasn't good for health
people,
and the environment. Very bad for the air. Actually, we're still seeing the effects in the soil all across the nation. Anyway, the point is, these consumer goods were found to be exposing people to lead, and that leads to lead poisoning. Now, for me or you, our brains are developed. It's not that big of a deal. However, lead is actually a neurotoxin, and once it gets into the body of a child, it causes very, very permanent and very bad effects. Well, what does that mean? At a low level, it messes with children in the sense that, okay, take a little boy, for instance, under 6 years old. He'll have problems in class. He'll be aggressive, behavioral issues. And the studies have shown that these boys actually have a higher rate of being troublemakers in adulthood. For females, they don't pay attention in class very well. Now that is a low level of lead poisoning. At the higher level, it can cause what's the word for it? Nervous system issues, brain damage. Some kids have actually even gone blind, stopped breathing.
Really?
They die, well, yeah, because it's poisoning your nervous system, and the nervous system controls your brain and how you breathe and everything that works in your body. So the point is that these kids can actually die if their poisoning is bad enough. So yeah, I mean that's
there have to be big quantities of lead to make that happen.
Yeah, so it's. No. So the idea is that it's measured in micrograms per deciliter. So without using too much science jargon, that's a really, really small amount. And lead is measured in that unit. So the point is that right now the lead level that's deemed hazardous at the state level is 5 micrograms per deciliter. That's when they've seen that children who have this level or higher are starting to be affected. And at that low level, like I said before, problems in school, for instance. So,
that is incredible.
Yeah, it really is. But then, you know, if you actually have close to 40, 35, 50, you actually have to get hospitalized, and they have to forcefully remove that lead from your body. Because lead poisoning, once it's in your body, it doesn't go anywhere. It actually goes into your bones, and it becomes part of your bones. So it's not going anywhere. Once it's in, they have to forcefully take it out. So
that's scary.
Yeah, it is
we
scary,
have to do everything we can to get lead out of our environment and where children are.
Yeah, but I mean, I can't, I'm not a professional as far as at least in the environment, but I could speak a lot, because I do it almost every day, as far as it being in consumer goods and how children are being exposed to it. So, for instance, when I go out in the field, I'm actually doing childhood lead inspections along with the nursing division. They couldn't be here today, obviously, it's a smaller set, but the nursing division, they go out, they're the leaders on this, and they actually formulate all the, they find out the information as much as they can, and they're also the case managers. I'm the one who goes into these people's houses once we find out that the child's lead poisoned, and I go in and try to find the sources. Now, back in the day, a lot of those cases were lead-based paint. The paint's chipping off the walls, the house is old, it's creating lead dust, kids are eating paint. That's not really the case in Woodbridge. In places like Newark or Camden, different story. They're still facing that issue on a very, very high level. But for us, though, it's mostly, I guess you could say, different cultures, families. We have a large portion of our children who are lead poisoned are of Asian descent, Indian descent, Pakistani descent. So in the East, and they have these practices that are actually exposing them to lead. So it's not the walls at all. It's not the paint. It's not the windowsills. Nothing like that. You know, it's really interesting. What will end up happening is that these children will be exposed to, for instance, I'll use an example such as Sindor. Sindor is a little, I don't know the proper way to describe it, but it's like a paint or a powder that gets put on the faces, on the forehead of those families that, you know, they get when they do their church functions, I guess you could say, their religious ceremonies. So that'll get on their forehead, and then let's just say their child goes and touches their forehead because they're young, and then they put their fingers in the mouth, and then they just got dosed with lead. You get what I mean? Spices are a common source.
Spices?
Yeah, spices, yeah. I couldn't bring a sample today, but we also have something called Ayurvedics. That's I don't know the exact definition of that word, but it's technically homeopathic medicine, folk medicine. And as I said before, lead is a really good binding agent, right? It keeps things together. So it's used in those things overseas because they don't care so much over there. They don't care about the lead being in those medicines, as I say. They get shipped over here because customs can't end up going through every single batch. They're not going to sit there with a meter and measure every single thing. And it's getting into the families' homes, and then they're taking it because they think it has medicinal benefits, and they're poisoning their kids. And you know,
do they add it to the food when they cook?
There have been cases of that Sindor stuff actually getting added into food, even though it's not meant for that. And then that's actually one kid when I was in college, they showed us a case study on that, and the kid went blind because he was dosed heavily with lead that was in Sindor. So, yeah.
Yeah, that's scary.
You know, it really is. Yeah, exactly. But anyway, it's a good thing what we do. Me and the nursing division, we work really hard every single day to make sure that we try. It doesn't happen overnight to get this lead out of the kids' bodies. And it's nice seeing a kid who might have a little bit of a behavioral issue, and then he comes back and you can see he's better now. You know, it's a nice feeling.
That is
refreshing.
Know?
Yeah, it really is, because, you know, and the best part is I'm getting paid to do it, too.
Yeah,
so that's a wonderful
nice,
part.
yeah.
So another interesting thing is that back in 2017, the state decided that the level that was permissible was not good enough. So at the federal level, I think it's 20 micrograms per deciliter. New Jersey was 10. Now we moved it down to 5 because our research has shown that, not the Woodbridge Health Department, but the state, it's shown that it's not good enough. Kids are still getting detrimental effects even between 5 and 10. So they lowered it to 5. So now that means in 2017, my predecessor, Vince, he had 12 cases for the entire year. I have 44. So for 2018, I had 44 cases where I had to go into someone's home and actually figure out what the source. And like I said before, none of them, not none, but only 3 of them were lead-based paint.
That is interesting.
I know, it really is.
So how do you get these cases?
Well, so what happens is that it's mandated that a physician has to test the children, I think at 6 months and 1 year, don't quote me on that, but they need to get tested by blood when they're young. If you pass that test, no problem. If you don't, it gets sent to the local health department. Oh. Exactly. So it's all standardized. It's all exactly. We follow up. We go into the home and we do our investigation. But like I said, most cases are not lead-based paint. If I was in Newark or Camden with the really old houses that aren't kept up too well, they have a very active lead-based paint program.
What about the lead in the water issue?
We test for that. We have Middlesex Water Company going because they have a vested interest in doing that as well, but we don't test it ourselves. They want to do it because they don't want to be responsible for poisoning kids. Exactly. So, yeah, and when we think of water, we think of Flint, Michigan, and that's a real tragedy we can go on for months about. But, you know.
And I don't think Middlesex Water does very good. They have quality water here that we're drinking, so we don't have to worry about
Absolutely.
that.
They have. I was actually at their facility showing our intern how they operate and everything like that. Beautiful setup, and they have $1 billion, machinery. If you get what I mean, it's very, very intricate. So yeah. What else was?
So. Dennis, your boss, was telling me something that I found extremely interesting, is that there's lead in dishes.
Yeah, exactly.
And, so talk about that a little bit.
There's lead in a bunch of different things. So you can find it, and again, none of it is really made in the United States. Sometimes it is, but most of the time not really. And the idea is that these plates, jewelry, medicines, religious items, they can be contaminated with lead on purpose. They don't try to contaminate it, but it's good in industrial purposes, not good in consumer purposes. So yeah, I mean, the China set that he had gotten it at like a flea market or a yard sale because he thought it was nice. So he brought it over because he thought it was painted a weird color, and he was like, Anthony, can you test it because we have this nice investment right here? And I tested it and it came up positive for lead. So if he was eating that, or eating off of that plate, and his fork chips up against the plate, he could be exposing himself to lead. Yeah, exactly.
So if, I mean, some of my china and dishes are, I mean, I got married in 1971, and I still have a lot of the stuff from back then.
It could, but the question is it damaged? Because if it's not damaged, it's not going to be leaching.
It doesn't matter.
So for instance, that wall right there, if we were to test that and it had lead-based paint in it, if it wasn't paint that was damaged, it's not that big of a deal. If it's intact, that's fine. It's the paint that's chipping, dusting, those are where we have issues with that. But yeah, I'll show you an example of this. So this actually is Sindor, right? We discussed that before. And then this meter is a very, very intricate, complex piece of machinery. And it's rugged too. They actually use this exact meter for mining purposes because there's federal regulations as well. And they have to be under certain levels, right? So this tells me about at least, I think it's like 70% of the metals on the periodic table, and it'll tell me the presence in their parts per million. So it'll tell me exactly how much of each thing is in there, but I only care about the lead, you know? So anyway, I'm gonna sit here with it. It's gonna send out an X-ray. The X-ray excites the electrons of the lead, and then the lead, after having been scanned, is going to come back and be red. And the idea is that each electron is going to vibrate in a specific frequency. So gold will vibrate differently than lead will vibrate. And then this thing's able to measure how much it vibrates and how much lead is in that vibration. If you get what I'm saying, that's the simple. Yeah. So this sample has 31,000 parts per million. So for every millionth atom of lead, for every million atoms of whatever's there, 30,000 of them is lead. That's highly poisonous. If you took I guess you could say, shot of this, you'd be highly dosed with lead poisoning. It would just immediately go to you. I don't know if that would be an immediate effect, but it would be definitely detrimental to your health. Another example is, it's a holder that has Sindor in it inside the homes that I go into, and they actually put it inside of that. But if this is damaged, it can leach onto your hand, and then if you're eating later on, then it can get onto your hands and then into your mouth, and then you're ingesting it. This is going to come up to 145,000 parts per million.
Oh my goodness!
So it's
that's
exactly.
way above the.
It really is, yeah. And there's, I think the number is 100 parts per million. But really, though, I just gauge it by if it's red and it comes up too high on this machine, then I know it's past the level that's acceptable for a child.
That's pretty amazing.
Yeah, it really
we
is.
have a few minutes left, but I do want the viewers to know that your department has done a big education program, so that people understand that they need to pay attention to the spices that they use.
Well, we really do, and especially at the health expos, we actually try to get as many people to come in and bring things that they are interested in that might be lead contaminated, and then I can actually measure for them on site. So I'm doing an active service for the people who come in, and I'm educating them in the field. You know, when they want to know if something has lead in it, then they just end up throwing it out once they find out that it does have lead in it. It's a really nice thing. Yeah,
it's a fantastic service that
yeah,
you're offering,
yeah,
and
it really
when you
is.
can help children to heal and be healthy.
Absolutely,
that's what it's all about.
But another important thing is, especially with this meter. So last year we did the math. This is approximate, but between me and 3 nurses, so there's 4 people in total. We spent 1,400 man-hours alone on lead investigations. That's phone calls, home visits, paperwork, just everything. We spent 1,400 hours collectively on that. It really is. And the point is that, you know, when I was petitioning to Dennis, we really need this machinery. It would speed things up, and it did. It really did. Because what I had to do before is I had to bring the samples to the county health department and borrow their meter and actually scan it on site there. It took too much time.
Absolutely.
Yeah, really. So
you
it's
can
been
just
a very
take this
big help.
with you and
yep, go right into the field and do things portably. It's perfect.
That is great.
Yeah, and I always try to, because a lot of the Indian community is very meshed together, and they care a lot about each other.
Right.
So when I have a child that's lead poisoned and I show the mom or dad what's wrong and what's contaminated, I tell them to tell their friends who have children to look for the same things. Do you know what I mean?
Right.
Yeah, so then if they find
Word of
those
mouth
things...
is the best education.
Exactly, but it's an uphill battle, and it really is.
Yeah.
But still, though, it's good to see those kids that we do come across. We see them get better. It's really nice.
That is rewarding.
Yeah.
And thank you. You know, we probably could talk about this for another 15 minutes.
I really could, yeah.
But I appreciate all the work that you do.
Yeah,
and
thank you.
We're lucky that we got you here
I
in Woodbridge.
appreciate that. Yeah.
So thank you.
It's been a good year and a half so far.
Terrific.
Hopefully many more. Yeah.
Great, great. So thank you for watching Greenable Woodbridge and for being part of the excitement and part of the change.